Hi, my name is Mary Smock, and I am presenting this video as my capstone reflective piece. In this recording, I will be suggesting various interventions and goals to aid Tiffany, a 30-year-old female, in effectively managing her anxiety. I will also highlight credible sources of evidence-based literature and explore the potential benefits of incorporating technology in her treatment plan. Furthermore, I will delve into the policies that impact healthcare workers suffering from anxiety. To conclude, I will reflect on the outcome of my capstone project and discuss the personal and professional growth I have experienced through this journey. Anxiety is a prevalent mental health condition that affects individuals across all age groups, often manifesting as a persistent worry, fear, or unease that can interfere with daily life. Understanding anxiety is essential for providing compassionate and effective care and recognizing how it may impact both patients and healthcare professionals. This capstone project will explore the complexities of anxiety, focusing on its physiological and psychological effects, common interventions, and the critical role nurses play in assessment, management, and patient education. By examining current best practices and evidence-based strategies, this project aims to enhance the future ability to support patients struggling with anxiety while also promoting mental wellness. Anxiety is a natural response or stress-perceived danger, often described as a feeling of worry, nervousness, or fear. While occasional anxiety is a regular part of life, especially during stressful events, it becomes a concern when it is persistent, excessive, and interferes with daily functioning. Anxiety can manifest through physical symptoms such as rapid heartbeat, sweating, restlessness, and fatigue, as well as emotional and cognitive symptoms like constant worry, irritability, and difficulty concentrating. When severe or chronic, anxiety may be classified as an anxiety disorder, which includes conditions such as generalized anxiety disorder, panic disorder, and social anxiety disorder. These conditions often require clinical assessment and intervention to manage effectively. My friend Tiffany Sanders is a 30-year-old certified nurse's assistant, is the patient I will be interviewing. She has granted me permission to interview her and share the medical information I gained for the interview. Tiffany has been having issues related to anxiety for several years. I chose Tiffany because she has coexisting conditions related to obesity, sleep apnea, and hypertension, which have also caused her to suffer from anxiety and depression. Tiffany also shared with me that she feels her anxiety has worsened from working the COVID unit during the pandemic. She stated that she felt an emotional burden of seeing the patients pass away, fears of contracting or spreading the virus, which increased her stress. She felt isolated from support systems, worked extended hours, and felt impending doom. The lasting psychological effects such as persistent worry, sleep disturbances, and emotional exhaustion remained even as the pandemic slowed. I chose Tiffany also because she confided she often feels overwhelmed and is considering quitting her job because of the mental toll. She denied any history of mental health disorders, but noted these feelings were new and persistent. During our last 3-hour session, I focused on interventions and goals for Tiffany. In instructing her, I implemented evidence-based practices. I made certain that her goals were SMART, specific, measurable, achievable, realistic, and timely. During our interviews, Tiffany confided that she was hesitant to try new approaches for anxiety at first, but after the first session, she was becoming more open to the ideas presented. To provide her with additional support in coming with anxiety, I suggested the implementation of telehealth services and the use of an employee assistant programs. As a nurse manager myself, I found it especially interesting discovering new ideas to utilize with my staff. Anxiety among healthcare workers is a critical issue that affects not only staff well-being, but also patient outcomes, team dynamics, and the overall healthcare environment. As a baccalaureate-prepared nurse, promoting mental wellness and resilience is important. Fostering an environment where staff feel safe to speak up, express concerns, and ask for help without fear of judgment or punishment. When healthcare workers feel supported, anxiety levels decrease and communication and care quality improve. Model open communication, encourage check-ins during huddles, and advocate for peer support groups. Promote access to counseling, employee assistance programs, and mental health days. Easy access to support helps prevent burnout and reduce anxiety-related absenteeism. Collaborate with human resources to raise awareness about existing resources and push for improvements when gaps are found. Reduce stigma by talking openly about stress, burnout, and anxiety in team meetings or informal discussions. Normalizing these discussions encourages others to seek help and reduces isolation. Share coping strategies, personal insights, or evidence-based resources during team discussions or wellness rounds. Demonstrate health, work-life balance, and self-care practices. Staff are more likely to care for their own mental health when they see leadership doing the same. Set boundaries, take breaks, and encourage others to do so, especially during high-stress periods. Organize workshops or short mindfulness sessions and promote resilience training. These strategies have been shown to reduce anxiety and improve focus, morale, and job satisfaction. Partner with wellness coordinators or use evidence-based programs to offer ongoing support. Promote a culture of appreciation and recognition. Feeling valued boosts morale, reduces stress, especially in high-pressured roles. Celebrate small wins, acknowledge personal goals, and encourage peer recognition. A healthcare worker with anxiety can significantly impact the healthcare system across several dimensions, including quality care, patient safety, and costs to the individual. Anxiety can impair concentration, judgment, and critical thinking, potentially leading to missed symptoms, delayed interventions, or incorrect treatments. Anxious healthcare workers may struggle with effective communication with patients or other healthcare team members, leading to misunderstandings or a lack of coordination. Anxiety might cause some workers to emotionally withdraw or become overly involved, both of which can affect professional boundaries and therapeutic effectiveness. Anxiety can increase the likelihood of medication errors, incorrect documentation, or procedural mistakes, all of which can directly threaten patient safety. Chronic anxiety contributes to burnout, which reduces vigilance and increases the chance of lapses in safety protocols. Anxiety may cause hesitation or overthinking during time-sensitive situations, potentially delaying critical care. Quote, anxiety in healthcare workers not only affects their own well-being, but can also have negative consequences on the quality of care they provide to patients. The fatigue, exhaustion, and lack of focus associated with anxiety can influence clinical decision-making and the ability to provide safe and effective care, end quote.